Hello, it's good to have you join us again for, I'm very sure about this, your most favorite program coming to you from NT2 Lagos Network Center. Like we always say on this show, we are ever delighted to know that you are out there with your pencil, with your biro, with your paper, with your handset, with your tab, ready to take down, sensitive or, exciting information coming from our guests. And today again, we have gone out there to look for yet another distinguished Nigerian to come into the studio and share with all of us, especially all of you who are watching, because this conversation is all about you. Share with all of us some very revealing truths and some, directions about how we are going to live in the new futures. What are we talking about here? So we are saying post-pandemic, what will life be like in Nigeria and all over the world? Then during the pandemic itself, what exactly are we doing? How responsible, and how sure are we that we are complying with all the things we need to do to make sure that we are saving our lives and the lives of our loved ones? We are going to be examining all these issues and many more, because we believe that the caregivers, the health caregivers, the frontliners, the front actors who actually carry the burden of all of us. Right now, the ratio is saying to me that in Nigeria, we have one doctor to handle about 5,000 patients. I wonder how many hours you can spend a day to do that. Whereas globally, the World Health Organization says that ideally, even in evolving economy like ours, a doctor, a medical practitioner should be looking after just 600 patients. But in Nigeria, one doctor has to sit down and treat 5,000 patients per day. Okay, so some of these are the issues we're going to be dealing with, okay, on this show. Before I get, you are going to get to see my guest, because my producer is a very smart guy. He has, he has produced like a stinger that will show us what my guest has been doing, what he has not been doing, and what he can do on this show, or what he can do for you. Don't call him for money. You can call him for drugs or something. Yes, maybe we'll be able to help you. Or ask him for opinion or advice. Yes, we'll be able to help you. Okay? So just stay with us, and shortly we shall reveal who our distinguished Nigerian is.
Hey beautiful, your eyes, your smile are all begging me to take you home tonight.
Now reading page 3.
Experience unlimited super-fast internet access from Entel 4G. Entel. Live more. Experience unlimited super-fast internet access from Entel 4G. Entel. Live more.
So that thing showed us just a little bit of who our guest is. Now he's here in the studio with us. It's my pleasure on your behalf to welcome onto the show for you to ask him all the questions you want to ask him about all the issues we're going to be raising here. Dr. JAPHET Olugbogi, you're welcome to Close Flow.
Thank you very much for having me. The sting didn't feel like I was the one.
Yes, they don't show that you're the one because you're looking much younger here. All that we saw, on that table is like you are 100 years old man.
A lot.
Yes, but that says a lot about what you have done. The journeys you have gone through.
Thank you very much.
You're welcome again. Now, it's important for us to quickly know that as a medical, the medical officer in charge of Apapa,
LCDA.
Yes, LCDA. Let's situate it from that local level. So, we are looking at the coronavirus. If you localized it, if you're taking it from that level, what is the level of impact we are dealing with here? In terms of, infections, in terms of positive tests, in terms of responses, and in terms of psychological impact.
Well, thank you very much once again for having me on the show. First of all, permit me to say that I am not here to represent the government or in my capacity as the medical officer of health. I am here in my capacity as the chairman committee on infectious diseases for the Nigerian Medical Association,
Beautiful.
Lagos branch.
Beautiful.
So I may not be able to delve into some intricacies
at the government level.
At the government level.
Okay.
But be that as it may, the level of infection all over the state and all over the country is such that we have what we call community transmission of a third wave of the COVID-19 right now. And we know that there are LGAs in Lagos where we have the highest concentration of COVID-19 spread and infection of the virus in the state. And those include Etiosa, local government area, Ikeja, and Alimosho,
yes,
and a couple of other LGAs. Apapa is not left out of that category, but it may be in the third maybe category behind those other ones.
The third ranking.
Yes, but when we had the pandemic first in Nigeria and in Lagos, Apapa Port had its own fair share of bringing in passengers of interest who tested positive for COVID-19. Most of those ships that were coming in brought in a lot of people who tested positive for the virus. And then because it was a new, on uncharted territory for us all in the country, before we were able to nip it in the bud, infection spread had already occurred in many ships and all that. But then again, we started getting hold of the whole situation, and then in Apapa right now, there are not so many people who have had the infection, and there are not so many people who are spreading the infection. But there is a sample collection center. When we started, we had 2 sampling collection centers, and one was it in the museum in Apapa, okay, somewhere around the General Hospital, and another one was in Sari PhD, which was directly under me.
Okay.
Now we have one that is about to be commissioned again, and that is at Ijora PHC,
okay,
very close to the Obas Palace. So other local government areas also have their own. There are about 20
centers. Yes.
There are about 20 centers in Lagos right now where are under the purview of the primary care system, where people can walk in and have their samples collected, and then their results would be relayed to them as at appointed time. That is in addition to Luth and Naima and IDH and yes, Lassus. So that's in addition to those other places. Then apart from that, vaccination.
No, we'll come back to vaccination.
Okay.
Yes, we'll come back to vaccination because that's another, as it were, critical. Yes, okay, yes, and that's actually, almost canonical to what we are doing in terms of how you have handled this. But do you think that we should accelerate or even escalate the immune boosters from our herbal solutions? Do you think that is a way to help reverse the, as it were, the psychological impact?
I'm a medical doctor. I'm not an alternative medicine practitioner. So talking about herbal immune boosters, it's totally out of my comfort zone. So please permit me
to ignore that.
To ignore that. But then again, we need to boost our immunity. And by so doing, we need to eat fresh fruits and vegetables and take the kind of drugs we have prescribed in the past, which are vitamin C, vitamin D, oral zinc, and a good level of sufficient rest. These things naturally, apart from the natural immune system that God has ordained every one of us with, these things can actually boost our immune system. So I would want to recommend them again. But then again, the area where you don't want me to go to yet, it's where I want to, hinge that on again.
The vaccination.
Vaccination, which is actually
no, but as an epidemiologist, let's just ask this direct question: is the vaccine a cure or a therapy?
No. The vaccines are not curable. They are just preventive. And as an epidemiologist, we harp on prevention more than cure. Although we also do some level of treatment, but most of the time what we do is actually to control before to prevent, and then when there's an outbreak, control. Those who actually deal in treatment will deal in treatment per se. But we like to prevent. We like to tell you what you need to do to prevent the spread. Maybe cholera, any infectious disease at all. And then when maybe for one reason or the other it happens, we step in and control, take measures to control the spread. And then those who want to treat, who would treat, will actually treat.
Okay, now, we have visuals of the vaccination, for our audience to be part of this conversation. Now, the thing about the vaccines that we have, which of the categories do we have in Nigeria at the moment? Do we have all of them? The one from America, the one from UK, the one from India, the one from Israel, the one from Russia? Which of the vaccines do we have here? And, how safe are these vaccines that we are deploying on the street?
Okay, we had the AstraZeneca in the country.
The Pfizer,
AstraZeneca in the country. And right now we don't have it anymore, because we've exhausted the doses that we had, that we were given back in March. But right now we have the Moderna vaccine, but it is not yet in circulation. Just this morning, the federal government called off, suspended the vaccination for one reason or the other. So we actually right now have only one type of vaccine in the country, which is the Moderna vaccine, which we are yet to roll out. But we had the AstraZeneca. Now, the Pfizer-BioNTech, it's supposed to be the best of the vaccines, given all the conditions. But the Moderna comes very close to that. The Moderna that we have right now comes very close to that in terms of properties, efficiency, and all that. But the Pfizer AstraZeneca vaccine it's also safe. So all the vaccines are safe, but they all have their own different properties. Some of them may be more expensive than others, so that can determine whether we can acquire them or not. But the ones we have, if you don't have money to buy something, somebody gives you something, you will collect it and say thank you and expect more. So at a point in time, we may have all the categories of the vaccines, the Johnson & Johnson, the BioNTech, even the Moderna. We may have them. Just this morning, in fact, I'm sure the training is still going on. We had the state training of trainers on how to deliver these vaccines, and we're already planning on incorporating all the vaccines and the vaccination exercise into our primary care system, which is a plus, which is a win-win situation for us. And then we're already planning for the 3 vaccines that we may likely have at the end of August or early September together. What I mean by that is that we're already planning that at a vaccination site we may have a Moderna in one cooler. If I may use the word cooler, we may have the AstraZeneca for those who took their first jabs of AstraZeneca.
They can come in for their
final jabs. And then we may have the Johnson & Johnson in another cooler. So at one vaccination site, maybe in September, some thereabout, we may have those 3 vaccines available.
And that will increase the capacity to...
Yes, from the information we have had from the LCDA. So we may have those 3 vaccines available, and those people who come will come for their respective vaccines, because we are aware that we should be aware that we are not allowed to give the second dose of we are not allowed to give Moderna to those who have already taken the AstraZeneca as first dose. So we are going to be giving the Moderna to those who are receiving it as a first dose. So people who come for their first dose are going to be receiving Moderna when it's available, or the Johnson & Johnson when that is available as well. But those who have taken the first dose of the AstraZeneca are going to be coming back for their second jabs, and we're going to be giving them the AstraZeneca vaccine.
Thank you very much. That is quite reassuring, and I like the fact that you have given us the profile of how the lower levels where you can get these vaccines, which means that it's almost available, or accessible,
that's
to everybody. Okay, well, that's very important. But how do you react to this? How do you react to this question of, so is there anything that can prevent you from being vaccinated? Can you live with a medical condition, for instance, that will stop you from getting vaccinated?
No. At first, when the AstraZeneca came, we had categories of people who could take the vaccines, and we divided it in 4 phases. And then the first phase were category of people who were health workers, frontliners, maybe paramilitary and military,
like you,
like me, like gas workers, broadcasters. Those who attend to a lot of people were categorized as first phase beneficiaries. So, and then when that happened, we gave them, and let's not forget that those who are also above 18 are the ones eligible. The eligibility for all the vaccines are anybody above 18. But the only contraindication right now is pregnant women. You know, it's better to be safe.
We will come to that. Sorry. It's part of, because we are also part of that campaign on how they can stop 50,000 women dying from childbirth.
Yes, I am.
Yes, so
now, right now, when the Moderna vaccine comes into play, almost everybody who is above 18 is eligible to take part of the vaccination, and then that includes everybody that has one debilitated disease or the other. If you have diabetes, kidney disease and all that, it doesn't preclude. In fact, those are the people that should make sure that they take the vaccines first. Like I said earlier on, I said almost everybody who is above 18, and that's because I don't want to include pregnant women. So apart from that, everybody is eligible to take the.
Okay, great. That is very encouraging. Now, but there seems to be another level of fears, being expressed by the public. They're saying that the vaccination seems to have taken on the toga of a visa application. In which case, if you want to travel, if you don't have the vaccine, that means you cannot travel. How do you react to that kind of global politics?
Well, it shouldn't be something that should scare or be fearful to the general public. I think it's only logical that when you want to go to another country where they have vaccinated their own population, you coming from your own country also need to show evidence that you've been vaccinated in your own country. And when you don't have an evidence, it means that you are a risk, a public health risk to that country. So they may want to ask you to either go back or ensure that you get vaccinated. And when you get vaccinated, of course, you're going to have to show the evidence that you got vaccinated. For instance, if before COVID, you want to travel to some countries, you have to show an evidence that you have had your yellow fever jab, maybe hepatitis, and some other infections like that. So it's in the same category.
Procedure.
The onus lies on governments in different countries to educate, to protect, their citizenry. And in doing that, they shouldn't or they wouldn't allow people coming from other countries who do not have evidence of, you know, having been vaccinated against some infectious diseases into their countries. I think Nigeria should start enforcing that kind of you know, policy.
Awareness. Okay, now that's a lot of public awareness campaign, really. That means you're taking over our job now. You don't get
I noticed we've all been working together.
Now, okay, but quickly, Japhet, it has been reported that the number of vaccinated persons across Africa is just about 2% of the entire population of the continent. So you're shaking your head. It's like you're not happy about that development.
I don't think anybody will be happy about that development because we coming on TV, coming on radio, you know, doing all sorts of awareness is to actually nip, you know, poke the government, especially governments of Africa. I was in Kenya some time ago,
yes,
and we talked about vaccine. In fact, the whole interview was almost about vaccine. And even then, that was several months ago, even then we realized that not so many African countries were making efforts to procure vaccines for their population. And the same thing is still happening now, even after several months. You see, those who even got free vaccines, I don't know what happened. A lot of them got expired in their care. So without pushing them out, they got expired in their care, and the COVAX and those who are giving us vaccines are not happy about this. You know, they can't be happy about this. So Nigeria as a country, we vaccinated less than 2% of our population. What do you think? What do you think will happen? How do you think places like countries like America, you know, UK, other European countries who have made sincere efforts to vaccinate their own population, how do you think they will react to the news of us coming into their country in droves when we know that it's not like we don't have these funds? It's not like we don't have these funds to use to acquire these vaccines.
How do we are misapplying the funds?
Well, I didn't say that, you said that. But what are we doing with our own funds? People
are prioritizing. Asking ourselves.
Yes, people are prioritizing. Other governments are prioritizing, you know, to get vaccines for their populace, for their people. Nigeria should be doing the same. Other countries of Africa should be doing the same. Because we are talking about Delta variant, we have Eta, Beta.
We'll come to that.
If we don't vaccinate at the same rate the Americans, other people are vaccinating, what it means is that the virus will come back to Africa. And we'll be dealing with it. And we'll be dealing with a lot of mutated versions of the virus. That time, the vaccine may not even work against those mutated versions at that particular point in time.
Okay, you have jumped the gun because I didn't want to come to the question of what the virus is all about until much later in our discussion. But because you have already raised it, I mean, now I have to juggle, you know, my chart. So what exactly is this virus that has this capacity to mutate so easily, so rapidly, that even epidemiologists like you cannot begin to anticipate what is going to come up next? What is this virus really?
It is just the feature that is pathognomonic of virus generally. Viruses generally have the ability to replicate themselves, to, you know,
to replicate means to have children.
To have children, yes.
Okay.
To have children, to divide more rapidly, to change their nature, if I may put it that way.
All viruses have that capacity.
Most viruses have that capacity, not just COVID-19 virus. HIV virus, hepatitis B, most of them, and especially when you are actually applying medicine, you know, to the individual, what they want to do, even bacteria.
No, say that again to our viewers, because they need to get this clear, I mean, in their minds.
Viruses have the innate ability to change their nature, to wriggle out of the present form they are, and so that take on another form, so that they can resist whatever you are throwing at them. That is what they do. And you know, they are going to go into the cells of the human beings. So there's little or nothing you can do to attack them in order to be able to kill them. Because as you're doing that, you're also killing the human being. So this COVID-19 virus is mutating in that form. And it's, the worst part of it is that it's even mutating faster than we can appreciate,
anticipate, yes.
that we can anticipate, and that we can study. that we can understand, because we're talking about the whole world. What is happening in South Africa is different from what is happening in India. What's happening in India is different from what is happening in Thailand. So there are different versions of the virus in different places because it's attacking different categories of people. Different people with different genetic makeup. So that is one of the reasons why the virus is moving at a speed that it looks like we cannot catch up with it. All the studies, all the efforts, it looks as if we can't catch up with it. But the veritable way by which we can catch up with it is by vaccinating the general public.
I like that.
At the same rate, almost at the same rate.
I like that. Before we lose sight of what the long-term danger is, okay, you are saying to us that, look, yes, this virus is there, but unlike other viruses, it is actually moving quite fast.
Yes.
Now, but the question therefore is this. I know that globally, the theories, all sort of theories about where the virus emanated from, sprang from, developed from, seem to be on the table everywhere. People are discussing it and all that. Now, so how disturbed are you about some of those theories? About the fact that it's, a biological weapon? About the fact that it's an error from some laboratory investigation? How disturbed are you about some of those claims?
Well, at the beginning, we had a lot of stories, a lot of theories, a lot of propaganda, and a lot of people even said it was a 5G connection or 5G chips and all that. Well, those are baseless, allegations. And we as scientists do not dwell on things that do not have empirical evidence. So I may have to decline on commenting on that. But we have all seen that the virus is there and is real. Whether it was even developed in a laboratory or it was released in the laboratory is not the question. The question is how
do we deal with it?
We mop it up from the world.
Okay. Now, why my producers said we should go on break, but I don't want to go on break because I'm enjoying this conversation with you. So why are we finding it difficult for epidemiologists, immunologists, public health workers, especially on the continent? I'm not worried about Europeans because they have gathered themselves. They have the formidable, gathering. Why don't we have our own team grouping themselves together quickly, rapidly, to share knowledge, to share information, and to share solutions? Why are we not having that done in Africa?
I think we actually have groups. We have a team of researchers and epidemiologists and politicians and administrators who are actually working to see what we can do but I think what is missing is that sincerity of purpose. The Europeans, always have a sincerity of purpose and good governance.
Well, the rest of the world, not just the Europeans.
Well, the rest of the world. Good governance, I mean, if you want to compare the indices of good governance in Africa to some other parts of the world, I'm sure the answer is there for us to all see. So I think that is exactly what is missing. We have the brains. We have the human capacity. We have the enabling environment. Well, okay, let me not say we have the enabling environment. Yes. I think what we need is the enabling environment and then maybe the resources. And then for resources to be channeled into all these kind of things, they have to have the sincerity of purpose. So I think that's what we need.
Okay, Dr. JAPHET is already suggesting to us that some of the things worrying us besides the virus itself will be the fact that we may not have the right environment to even deal with it, as quickly as we can. We are not going anywhere. We just to give him a breather so he can drink some of the. Well, we don't have a champagne to celebrate him, but I'm sure he will love this healthy drink that we have put in his front.
I like to take tea.
Yes, he says he wants to take tea. Well, all of you watching at home, you're going to join the conversation shortly. Just stay with us, and then you can then let us have your own comments or your questions or what you think you should be doing next.
We must dilate the eyes, we look for if they have cataract, to look at the back of their eyes, they have glaucoma, to do a full workup for them.
You will remember the giant strike they will do. You will remember with Australia, going to be looking deeper than we ever looked in before to ensure that we close all the loopholes.
And I think
Every edition is an arresting conversation with distinguished Nigerians from various strata of the society, bearing their minds on how we can realize the Nigeria of our dreams. Join us live on Closed Flow, Monday, every week here on NTA2 Lagos Network Center. Closed Flow. The conversation is about you.
Thank you for staying with us. I would like to said on that our sting, the conversation is about you. It's about how you and I, we're going to stay healthy. And just like Dr. JAPHET says, how do we now overcome this virus that is threatening to end, well, the world as we know it? The numbers to call for your SMS messages to be read out so that Dr. JAPHET Olugbogi can react or respond or answer your questions, your queries. SMS that you're going to send to us should go to this number. Please take your biro, like I've taken mine, and your paper, and let's have these numbers written down so you can then send your messages. 080-6350-8434. Let me say that again. 080-6350-8434. It is safer to send SMS. That's why I call that one first, because we always experience drop calls when you send your voice messages. But just in case you still want to hear your own voice and you want to hear the candid opinion of Dr. JAPHET, then call us on this number: 080-5975-3044. 080-5975-3044. So call us and let's see how this conversation is going to change the way we deal with this pandemic. Now, just before we went on that break, you tried to persuade us to see that we need to create the right environment on how to deal effectively with this before it gets out of hand, especially on the continent. Now, one thing I've discovered here is this, for instance, and I said it in my intro. As a medical practitioner, you are expected to deal with 5,000 patients per day in Nigeria. So how exactly are we taking care of first responders, mainline actors like you people? How, I mean, when you look at the Nigerian profile, how therefore are we creating the right environment to make sure we extinguish this pandemic?
You see, that topic is a huge topic, and it's a very emotional topic for practitioners like us.
Good morning. 1 second, Dr. JAPHET. Good morning. Hello. Yes, okay. From Aja. Yes, let's have your comment or your question.
Yeah, I just wanted to make a quick point. For doctor to react to some videos making the rounds as to those that took the vaccine. Their body seems to be magnetic. They seem to be having a magnetic field on their body. What can you say about that?
Quickly. Yeah, quickly. The vaccines do not contain any magnetic substances. People are just playing pranks on us. Some people are just playing pranks on themselves. In fact, the first person in America that, I can't remember,
America or UK,
or whether it's America or UK, that carried out that prank, a lady, she came back to say that on TikTok that it was just a prank. She was just trying to catch fun, and she was surprised that the thing had garnered so many views. So people are just trying to play pranks. If you take the vaccines or any vaccines at all, try to put a spoon there. You see that it's not going to be magnetic. But then again, if you have sweat on your body or some oily cream, just try to stick a spoon there. You see that it's going to stick. These are the kind of things that we used to do when we were in primary school and secondary school. Just naughty, and it is not absolutely false. The vaccines do not.
Okay, you can see that the old claim or the old story is laughable. That's what it's saying, that it was just fun. It wasn't anything really serious. So don't let's apply too many truths to some of these pranks. Okay, but seriously, let's come back to this serious matter. So you, for instance, you have to deal with 5,000 patients per day. How? So.
Like I said, it's an emotional topic for us medical practitioners, because before the advent of COVID-19 and maybe brain drain, as it is now, we had one doctor to about 2,000 patients. Now we have...
And that time we were crying.
We're crying. That time we had about 1,000. Now we have about 1,000 to 5,000 as we claim. And we are all aware that the resident doctors all over the country are on strike.
Yes.
Why are they on strike?
At this critical time.
At this critical time, why are they on strike? Why would government allow such a thing to happen at this critical time? In fact, at any point in time at all, if you don't have enough doctors, should you allow the few ones you have go on strike for everything at all? Shouldn't you, find a way to meet them in the middle? These are the things, some of the things we said we are doing wrong. I was speaking to a big brother of mine about 3 months ago. He was in Ireland. He was in a hospital in Ireland. He complained of abdominal pain and maybe headache. And he called me. He wanted me to see the room where he was given, in the hospital where he was. Up to today, I regret that I didn't pick that call because I was busy. He wanted to show me that he was in a room where he's being given something close to a 3-star treatment in a government hospital, government facility. It's not even their citizen.
Not a private hospital.
Not a private hospital. It's not even their citizen. And he told me that the food, the air conditioner, the room itself, the size of the room, the human resource
deployed.
Yes,
to attend to him.
To attend to him. It wasn't even an emergency. You understand? You see, and he made a statement that we haven't even started. That's what he said. When I told him that, Uncle, but we are trying. We are now we are trying. I think now we are trying. He said, no, we haven't even started. Go to Lasut, go to Luth. You will see their best effort there is not even comparable to maybe the worst in America. I was seeing a short movie last night and I saw how residents were being treated, Okay, we saw a circular just a few days ago.
Yes.
From Ghana.
Yes.
Where they were being, touting them to increase their allowances. They didn't even demand for it. Here, resident doctors are demanding and asking. And yet, we're not doing it for them. These are agreements which they have reached over several months, over several years, which are not being honored. If government does not honor its own agreement, who should?
Okay, now, that really is a sad commentary on what we are saying when we say we need the right environment for us to be able to deal, to combat, this raging pandemic. But the good thing we must say, it is commendable. The Nigerian medical team, the practitioners,
they are very dedicated.
Yes, they are committed to.
Very dedicated.
Now, but how can we reverse, as it were, this imbroglio or this, as it were, because you chair an association. So how are we going to use some kind of, if it's possible, foresight to rearrange the whole thing and make sure that you guys are back at work?
I think it has to start from the grassroots, not just from the top, from the grassroots, from the local government.
I like that
system.
They must understand that they have a stake.
They have a stake. They have a duty. We understand that the primary care system should naturally be under the local government system.
Yes.
Now, if they are under the local government system, then it means that the local government should be funding them appropriately, adequately, sufficiently, as at when due. If you're going to get funding from maybe the state government or the federal government or even developmental partners,
it should be
an additional. But the local government system should take responsibility, and care for all the facilities under them. When they do that, the state should take a cue from that and take responsibility for all the facilities, all the general hospitals, which are secondary centers, under them. Funding is very key in health. Funding and human resources. You see, a lot of doctors and health workers are running overseas because they want that enabling environment. You see,
it's not about the money they're earning.
It's not just about the money they're earning. Of course, the money is their, is their right.
Yes,
it's a motivational factor. It's an entitlement. But the enabling environment. You see, there was a time a doctor traveled overseas and he was going to use this thing that we used to tie somebody when we want to put in the cannula.
Yes.
The guy caught the rope of the drip and he was using it to tie. And they looked at him like, are you okay? Are you okay? Where are you coming from? We have tourniquets, good ones.
Yes, that you can use.
Ones that you can use that. Why are you cutting? Because that's what we are used to here. That's one of the systems we are used to here. We are made to practice with almost anything we can find so that we can get the job moving on, so that we can
save lives.
So we can save lives because we don't have the right tools, we don't have the right equipment, or we don't have enough of them. That was why that doctor improvises, and he thinks maybe he's still in Nigeria. And so they were looking at him like, where are you coming from? Why are you using? Come and take tourniquet from here. We have, and when I was in training as a house officer, all those general hospitals, or most of them, we had a drawer where we kept needles and syringes, IV infusions, all those things free of charge. You could go there, pick anyone. In fact, we used to keep some in our wardrobe.
Yes,
because if you need them urgently, we will quickly have access to them and use them. Go to those places now. Patients have to buy everything. As you get to the general hospital, you have to buy all these things before anybody attends to you. It is not available there for you to for the doctor to just pick and quickly take sample and send you to the lab so that the whole process can be fast. But those things are now mundane. So we need to put funds into the medical healthcare system. We need to reorganize the healthcare system. If we cannot put enough funds, then we should ensure that health insurance.
Hello? Can you say that again? Your name is... Hello? Yes, your name is what? Good afternoon. Good afternoon. Your name is what?
My name is... Hello?
Go on, speak up. Yeah, okay, all right. What's your question? Quickly.
Okay, I want to ask a question.
Go ahead.
The pandemic talking about, what is the usefulness of it?
The usefulness of what?
The vaccine for COVID-19.
Okay, so the vaccine, what is it useful for? That's what she wants to know.
Okay, the vaccines are to create some awareness in our body. When we take the vaccine now, it will create some awareness in our immune system so that when we get or contract the COVID virus, the body will have recognized it already and will have raised the soldiers that will attack the COVID virus, such that whenever we get the virus, we won't be able to be affected by it. The virus won't be able to fight the body because there are already soldiers who are mounting roadblocks and all that to fight the virus.
In our bodies?
In our bodies. That's what the vaccine is for. And not just COVID vaccine, that's what vaccines generally are for.
Okay, now you have already mentioned earlier on that vaccines are not curative, they are just preventive. Okay, so now are you saying that even if you haven't taken the vaccine, haven't been vaccinated, you can still be infected?
Yes, unfortunately, unlike some other vaccines, these COVID vaccines, let's not forget that they were approved for emergency use. So
yes, because of the way
the pandemic was going on, we wouldn't wait for 5-10 years for us to have
the perfect vaccine.
Yes. So the vaccines we have right now, after taking them, one can still be infected with the virus. But the vaccines, when you have had the 2 doses of the ones that need to, give you 2 doses, they protect one from the symptoms. When you have the virus, you may not develop the symptoms. And when you develop if you develop the symptoms, you may not have a serious illness from the virus. Yes, if you have had the 2 doses of the vaccines. That is the advantage they
getting
are
vaccinated
in UK, in America, in Spain, in France, and all those places now, because they have vaccinated most of their population. You see that the number of people who are hospitalized are now reduced drastically. The burden of the virus is on the economy, on the society, is now reduced because they've vaccinated most of their population.
Okay, now the flip side of the coin. What are the side effects that you fear most coming from the vaccination?
Well, the side effects I fear most is from those who have allergic reactions. There's some people naturally in the society that have allergic reactions to things. Sometimes they may not even know that they have they have that innate allergic reactions. So when they take these vaccines, some of them can react badly to it. This is we're talking about a fraction of the population.
Yes.
Now, when these people take the vaccines, for one reason or the other, they may react to it. There are some people that react to some drugs, certain items, certain raw materials. So they may react badly to it. And I had an experience with one of my clients who reacted badly to her, and I stopped her. You are not taking the second dose. You see, because even the first dose, it's enough immune. It can create enough immunity for you.
Yes.
But we give the second dose so that people can fully be vaccinated. But when she took it, she had a terrible reaction to it. And it wasn't just that. I remember when we first started working together and we gave her some anti-malaria, she reacted so terribly to it. So that woman now, I'm sure if she's listening, she'll just be laughing. That woman
but that's again due to your own, well, as it were, experience.
Yes,
and your own response.
Your own experience.
Yes.
So people who know that they have reactions to things should consult their doctors, so that, or when they take the vaccine, should be monitored very well.
Okay, well, that is good news for all of us, especially for those who are still reluctant, getting vaccinated. Now, another thing that I need for us to clear very quickly is this: when we say we are building herd immunity, what exactly is that, and what do we need to do that, to build herd immunity to reverse this, as it were, the onslaught of the pandemic?
Building herd immunity just literally means that if you have 10 people in a room, you are trying to protect at least, you are trying to protect all of them by protecting some of them. Now, when you give about 7, 8 of them the vaccine or anything at all that can protect them from anything you are protecting them from, it is not likely that the remaining 2 people will get the infection once those 8 are protected. Let me make an example to you. If you have 8 people or 10 people sitting down in a column,
yes,
and they are supposed to pass something to themselves, they're supposed to pass a virus to themselves.
Yes.
So maybe one person passes number 2, number 3 to number 4. Once you are vaccinated, 1, 2, 3, 4, 5, the virus will not likely move away from the person to another person who has not gotten it. So, in essence, you are vaccinating majority of the society to protect the whole society.
All right, Japhet, it's a pity the conversation cannot continue, because you know that we are only a portion, like in a column. We are just a portion of the number of hours we need to transmit. So thank you for coming on the show.
Thank you very much for having me.
But we want to say something to our viewers at home before we leave the studio?
Yes, the Nigerian Medical Association Committee on Infectious Diseases wishes us all very safe and clean health. But we want to urge you to wear your face masks when you go out and when you are in public. One of the most veritable ways of preventing yourself from having the virus is by wearing your face mask. So if you make it a habit by wearing your face mask when you go out, when you are in public, when you are with other people, you are preventing yourself from picking up the virus. And then whenever the vaccines are being rolled out, please endeavor to get vaccinated against the virus. And then our level of hygiene is very, very important. I don't want to call us a dirty set of people, but we need to improve on our personal hygiene. We need to, wash our hands as frequently as possible. Ensure that we stay safe when we are in the midst of other people. Staying safe means that we give some level of distance from other people.
Just like we're doing.
The reason why we say that is so that when somebody coughs or sneezes or brings something out,
before it gets to you,
it will have landed on the ground. So that's why we encourage that social distancing. So
okay, well, I'm sorry, Japhet. It's like a preacher man. If I give him more space, there's going to be here till tomorrow. So that's about it until we get to bring you back again to come and speak. Maybe that time you come and speak on behalf of the local government. Thank you again for coming on the show.
Thank you for
having me. For our viewers, well, it's sad we have to ask Dr. JAPHET Olugbogi to leave now, because we have other programs to run. But I'm reassured that all of you are going to join us again, next week for yet another edition of unveiling a distinguished Nigerian, as see how Nigeria can become one of the greatest nations on the face of the earth. And until then, it's never a bye-bye from us. It is always go to our social media websites, platforms, and let's have your comments and your questions, or maybe your own suggestions on what we need to do on this show. Thank you, and bye for now.